You're listening to RazorCast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.
Hello, everyone. This is Liz Harvey coming to you from our RazorCast studios in New York City, where we are dedicated to bringing you top-quality advice from many of the leading expert professionals across the U.S. In today's episode, we are speaking with Dr. Behzad Nazari. Dr. Nazari is the founder of Antoine Dental Center, a family dental practice with specialized dental services in Houston, Texas. He began his career as a registered pharmacist after graduating from Texas Southern University, and he then pursued dentistry and graduated with honors in a Doctor of Dental Surgery from the University of Texas at Houston. Dr. Nazari holds certificates in orthodontics, implant dentistry, and cosmetic dentistry. For over 15 years, Dr. Nazari has been serving generations, and he is widely considered to be one of the top dentists in the country, and he's also a contributing member of our national network of industry professionals. Today we're going to talk about a very important topic, orthodontics, long and short term. Hi, Dr. Nazari. How are you today?
I'm doing good. How are you doing, Liz?
I'm doing great. Thanks so much. And my first question, what types of conditions do orthodontic treatments help to fix?
There are many conditions that orthodontics can help to correct. Usually what the public is aware of is they say I have a crooked teeth, I have spaces between my teeth, I have gaps between my teeth, I have a big overbite. Those are what the public is aware of. But orthodontics can help correct many features or many conditions in a patient, like situations like having open bite, like the teeth cannot reach, top and lower teeth cannot reach each other when we bite. It can be in the front or it can be in the back. There are situations like an underbite. We can have uneven bite. We can have broken teeth that if you want to save that tooth, we need to have orthodontics to help to make that tooth a little bit longer so we can put a crown on it. We can correct some of the impacted teeth that they have difficulty erupting to the mouth. Orthodontics can correct in accidents. When a patient is in a car accident and they have a broken jaw, they can line up all the teeth and help the surgeon to correct the surgery. Basically, these are the overall general categories that orthodontics can correct.
All right. And what different types of long-term and short-term orthodontic treatments do you offer?
Well, the difference between long-term and short-term orthodontics is the duration, and also clinically is that if it's going to affect the bite or not. Short-term orthodontics is usually between 6 to 9 months, and then long-term is longer than 9 months, anywhere between a year and 2 years, and sometimes about 2.5 or 3 years. After a complete evaluation by a qualified dentist or orthodontist, if the dentist is definite that the orthodontic treatment is not going to affect the bite of the patient, they can proceed with the short-term orthodontics. Short-term orthodontics can also be used in conjunction with additional cosmetic treatment that the patient do not want to be on braces for a long time. They can have a combination of short-term braces plus cosmetic procedures. And long-term orthodontics are the ones that, the patients have very crowded teeth. They have some habits like sucking their thumbs, or they have a tongue thrust condition, or they have impacted teeth that they want to bring it, and it takes a longer time. And also, all the changes can affect the bite of the patient, which may take as long as 2.5 years.
Okay. And please describe the advantages of Invisalign. It seems like a great choice for busy adults.
Yes, Invisalign, basically the only advantages Invisalign has versus the traditional braces is the not wearing braces, as it doesn't show, which is very convenient for the patients. You don't see wire, you don't see brackets on the teeth. These are clear aligners that patients can place them in their mouth, and they are virtually invisible. And and they can do almost anything that traditional braces can do.
And switching gears a little bit, how do you determine if a child is ready for orthodontics?
The recommendation of American Dental Association and American Association of Orthodontists is to any patient at the age of 7 to be evaluated for orthodontics. That's the age that when we take a complete X-rays from the patient, we can see all of the teeth, and we can evaluate the eruption path of the teeth. Is going to be any complication? Is going to be any problem with the teeth coming in? Is there going to be any crowding? Is there any habits that we need to control at this time? Or there is going to be any bite problem such as crossbite? So age 7 is the recommendation age for the evaluation of orthodontics. It doesn't mean the patient is going to get braces. It can be some simple appliances, and that we can start the patient on.
Great. And what is the regular maintenance routine like with orthodontics, and what is the follow-up process once the braces are removed? Do people still wear retainers like when I was younger?
Depending on the case, we usually see the patient every 4 weeks for the regular maintenance of the braces. They come in, we take up the wires, we make sure that everything is going fine, and then we replace those little colored rubber bands on the patients, depending on the case, that how the case is progressing. We change the wires, or if it is Invisalign, we check the patient for the alignment of the teeth, and we go on to the next tray that the patient is getting, and we make sure that that the patient is following up with the proper oral care. And again, the hygiene is very important. Anywhere between 4 to 6 months, we try to get the patients get a cleaning done. And after the orthodontic is completed, the follow-up is very important. That we make sure that the patient comes in depending on the case, on intervals anywhere every month, from 1 month to 3 months or 6 months, to check that there is no relapse on the case and the patient is following up with the retainers. Yes, you still need to wear your retainers. Nothing has changed as far as the retainer from the time that you and I had braces in the past. There is a follow-up that is necessary that we recommend depending on the case and on the age of the patient, how often they need to come back, so we can check the retainers and alignment of the teeth.
Great. Thank you so much, Dr. Nazari. We know you're extremely busy, so I just want to thank you for your time and help today.
Thank you, ma'am. Thank you for having me.
And for our listeners across the country, if you are interested in speaking with Dr. Behzad Nazari, you can either go online to www.antoinedentalcenter.com or call 713-364-8990 to schedule an appointment. And on behalf of our entire team at Razorcast, we want to thank you for listening, and we look forward to bringing you more top-quality content from our country's leading industry professionals.
You've been listening to Razorcast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.